So can you tell us more about the immunobiology of vitiligo?
Yeah,
please?
sure. So vitiligo is a clinical disease that causes white spots on the skin. And we know that those are caused because it's an autoimmune disease. Immune cells crawl into the skin, they find the melanocytes, and they kill them. And then there's no more pigment made in that area, and it causes a white spot on the skin. We know that the idea was, could we develop a treatment that targeted those cells and prevented those cells from getting in there to develop a better treatment for vitiligo? And we know that we've been able to do this with psoriasis. We can target one cytokine to make psoriasis better, but those drugs don't work for vitiligo. So we were really actually interested to better understand how the immune system works within the skin to cause disease.
And can you tell us more about the best approaches, maybe, and what is the best way to cure it, if there is a way to cure it nowadays?
Yeah, so because it's an autoimmune disease, immunosuppressants do well for vitiligo. So we use topical calcineurin inhibitors, topical steroids. Those suppress the autoimmunity and allow the pigment to come back. Those are the conventional treatments that we used, and they're actually used off-label. They are not approved in the US by the FDA, but we can use them because they're made for other diseases. Phototherapy, narrowband UVB phototherapy, is also a very effective treatment for vitiligo. It's probably the most effective. And we think that that's because it also suppresses the autoimmunity, but stimulates the pigment cells, the melanocytes, to come back.
Okay.
Some of the new treatments that we're looking into now, there have been JAK inhibitors have been put in a few patients, and they look like they're effective as well. And so we're really excited about kind of what's coming up. One of the frustrating things about treatments for vitiligo and most diseases is that when you stop the treatment, the disease relapses or comes back.
Okay, so it's a long-term and long-life treatment for everyone. And I imagine that everyone is different when someone has vitiligo. So it's different for everyone.
That's right,
When
yeah.
you cure it.
Yep, it changes. Some people get just a little bit of disease and they have it and it stays that way for the rest of their lives. Some people get a little bit of disease and it spreads and takes up a bunch of their, a lot of their body. Some people respond to treatment and stay better for a while, long time. Some people relapse as soon as the treatment is stopped. So we have to try to understand why all those things happen.